So Chapter 2 discusses the urine specimen types collection and preservation needed to be able to stabilize urine for analysis. So what is the purpose of performing a routine urinalysis? So one, it's going to be aiding in the disease diagnosis. Two, it's a screening tool used for asymptomatic or congenital or hereditary diseases. Three, it's to monitor any disease progression. And four, it's to monitor therapy effectiveness or complications. So really, to obtain accurate urinalysis results, the integrity must be maintained. So if a urine specimen is submitted for testing that's inappropriate, or if the composition has changed due to improper storage handling, testing will produce results that don't reflect the patient's condition. So in such situations, the highest quality reagents, equipment, expertise can identify anything unacceptable towards the patient sample. So why do we study the urine? The urine is actually a fluid biopsy of the kidneys, which can provide an important amount of information about someone's health. The kidneys are the only organs that can have their functional status evaluated by non-invasive means. And because urine is an ultrafiltrate of plasma, it can be used to evaluate and monitor body's balance or homeostasis and monitor many metabolic diseases. Usually, urine samples are easily obtained and their collection only inconveniences patients very briefly. So the type of specimen that is selected, the time of collection, and the technique are usually determined by the tests needed to be performed on the urine sample. The three basic types of urine specimens are morning, random, and timed collections. Note that the ideal specimen needs to be adequately concentrated to ensure, upon screening, the detection of chemical components and any formed elements of interest. These factors depend on the patient's state of hydration and the length of time the urine is held in the bladder. So let's talk about first morning samples. To collect a first morning specimen, the patient voids before going to bed and immediately on rising from sleep to collect the urine specimen. Because the specimen has been retained in the bladder for about 8 hours, the specimen is ideal to test for substances that require concentration or incubation for detection, for example, nitrites and protein. Although this specimen is mostly concentrated and frequently the specimen of choice, it's not the most convenient to obtain, as the patient needs to pick up a container at least 1 day prior to their appointment. And in addition, the specimen must be preserved if it's not going to be analyzed within 2 hours. Now, a random urine specimen is the easiest form of urine to collect. Random specimens can be collected at any time, usually during the daytime hours, and without any type of patient preparation. The only caveat to this is because excessive fluid intake and strenuous exercise can directly affect urine composition, random urine specimens may not accurately reflect the patient's condition. But despite this, random specimens are usually satisfactory for routine testing and are capable of detecting any abnormalities that indicate a diseased process. Now, as for timed specimen collections, because of circadian rhythm or variations during the day, excretion of many substances and functions such as proteins or hormones, and effects of exercise, hydration, and body metabolism on excretion rates Quantitative urine assays often require a timed collection. Timed collections, usually either 12-hour or 24-hour, eliminate the need to determine that excretion is optimal and allow comparison for patterns from day to day. So timed urines can be divided into two types: those collected with a predetermined length of time, example, a 24-hour collection, or those collected at a specific time of day, for example, 2 p.m. Now, depending on the analyte being measured, a urine preservative may be necessary to ensure its stability throughout the collection. So now let's discuss some collection techniques. A routine void requires no patient preparation and is collected by having the patient urinate into the appropriate container. Normally, the patient requires no assistance other than clear instructions. These routine specimens, whether random or first morning, can be used for routine urinalysis. For other collection procedures, the patient may require assistance depending on the age and condition and technique for collection. For a midstream or clean catch specimen, if the possibility of contamination, example from discharge of the vagina, exists, or if there's any kind of bacterial culture that's desired, this type of specimen should be obtained. Collection of these specimens require additional patient instruction, cleaning supplies, and perhaps assistance for any type of elderly or young patients. So before the collection, the glans penis of the male or the urethral meatus of the female is thoroughly cleansed and rinsed. After the cleansing procedure, a midstream specimen is obtained when the patient first passes some urine to the toilet, then stops and urinates the mid portion into the specimen container. Any remaining urine is passed into the toilet. To prevent contamination of this specimen or the container, the interior of the container must not come in contact with the patient's hands or perineal area. So in essence, this technique allows the passage of initial urine that contains any kind of urethral washing or any kind of normal flora into the toilet and allows collection of a specimen that represent elements from the bladder, ureters, and kidneys. Now, catheterized specimens are obtained after a patient has been catheterized. That means an insertion of a sterile catheter through the urethra goes into the bladder, where urine will flow directly from the bladder through the indwelling catheter and accumulate into a plastic reservoir bag. The urine specimen can be collected at any time from this reservoir, and because urinary tract infections are common in these types of patients, most often these specimens are sent for bacterial culture. A suprapubic aspiration involves collecting urine directly from the bladder by puncturing the abdominal wall and then distending the bladder using a needle and syringe. The normal sterile bladder urine is aspirated into the syringe and sent for analysis. This procedure is used principally for bacterial cultures, especially for anaerobic microbes and infants in whom specimen contamination is unavoidable. Pediatric collections. So newborns, infants, and other pediatric patients pose a challenge in collecting appropriate urine specimens because they are unable to urinate voluntarily. There has been a commercially available plastic urine collection bag that is hypoallergenic, that adheres to the skin, that can be used. The patient's perineal area is cleaned and dried before the bag is placed onto the skin. The bag is placed over the penis in the male and around the vagina in the female and the adhesive firmly attached to the perineum. Once the bag's in place, the patient is checked every 15 minutes to see if there's adequate specimen that has been collected. The specimen should be removed as soon as possible after collection, labeled and transported to the lab. Now, for every specimen that's collected, there must be rejection criteria used in every laboratory. So any unlabeled or improperly labeled urine specimens, for example, name or ID on the container or order requisition doesn't match, are probably the two most common reasons for specimen rejection. Another reason for rejection is a request for a urine culture when the urine specimen was collected in a non-sterile container, or when midstream clean catch instructions were not provided to the patient for collection. Other causes include specimens that have not been properly stored, and there's possible visible contamination with fecal matter or other debris. Now let's look at the types of containers needed for urine collection and storage. Containers for urine specimen collection must be clean, dry, and made of a clear or translucent disposable material such as plastic or glass. They should stand upright and have an opening of at least 4 to 5 centimeters and have a capacity to hold up to 100 milliliters. A lid or cover that is easily placed onto and removed from the container is needed to prevent any type of spillage. Specimens that are transported require a lid with a leak-proof seal. Commercially available, these disposable non-sterile containers are available and economical. Now, when we talk about labeling, all specimen containers must be labeled before or immediately after collection. Because the lids are removed, the patient identification label is always placed directly on the container holding the specimen. Under no circumstances should the label appear only on the removable lid. So urine specimens should be delivered to the lab immediately after collection, but sometimes this is not always possible. So if there is a delay in specimen transport, if it's longer than 2 hours, precautions must be taken to preserve the integrity of the specimen, protecting it from the effects of light and room temperature changes. So a variety of changes can occur in unpreserved urine. These changes can affect any physical, chemical, or microscopic examination of the urinalysis. Changes in the physical exam result in alterations of urine solutes to a different form, resulting in a color change. Bacterial growth causing an increased odor because of metabolic proliferation of bacteria, and solute precipitation in the form of amorphous materials decreases the urine clarity. Individual components of the chemical exam, for example glucose or pH, can also be affected. Most often these changes result in removal of the chemical entity by various mechanisms leading to false negative results. Now in contrast, urine nitrate and pH will increase in unpreserved urine as bacteria can proliferate, converting the nitrate to nitrite and metabolizing urea to ammonia. The microscopic changes result from disintegration of formed elements, particularly in alkaline urine, or from any unchecked bacterial growth. There is no single urine preservative that is available to suit all testing needs. So the preservative depends on the type of collection, the test being performed, and the time delay before the testing. The easiest and most common form of preservation is refrigeration at 4 to 6 degrees Celsius and is suitable for a majority of specimens. Any urine specimen for microbial studies should be refrigerated promptly if it cannot be transported directly to the lab. Refrigeration prevents bacterial proliferation and the specimen can remain suitable for up to 24 hours. But if we're considering a timed collection, particularly a 12 or 24-hour collection, it may require addition of chemical preservative to maintain the integrity of the analyte of interest. Regardless of the preservative necessary, urine collections should be kept on ice or refrigerated throughout the duration of the process. Now, the collection preservative varies depending on specific things such as the test method, how often the test is performed, and the time delay in transport conditions. The preservation of timed urine. So any timed urine collection should be transported to the lab as soon as possible after completion of collection. The total volume here is determined and the specimen is well mixed to ensure that it is homogeneous and aliquots are removed for the appropriate test. At no point during the timed collection can a urine be removed or discarded even if the volume is recorded. This would invalidate the collection. So we want to keep this on ice. There may be a chemical additive necessary, and again, delivered as soon as possible. So at times it has been necessary to verify that the fluid present is actually urine. This may occur in labs that perform urine testing for illicit drugs. In these situations, particularly when the urine collection is not witnessed, the individual may have the opportunity to add a substance to the urine or alter the specimen. Another possibility is that the liquid in the container is not urine. So the specific gravity, pH, and temperature can be helpful in identifying urine specimens. The physiological sample range for urine for pH is 4 to 8. And for specific gravity is 1.002 to 1.035. In a normal, healthy individual, the temperature of a urine immediately after collection is usually between 32.5 and 37.5 degrees Celsius. If this range is exceeded and the temperature is lower or higher, the urine has been altered in some way, or that fluid is not urine. Now, on occasion, if there's a procedure called an amniocentesis done, it could be contaminated by passing through the bladder. So in this instance, there needs to be identification of the fluid being urine. So the single most useful substance that identifies a fluid as urine is its uniquely high creatinine concentration. So it's approximately 50 times that of plasma. And similarly, concentrations of urine, urea, sodium, and chloride are significantly higher in urine than any other body fluid. So that a healthy individual normally has no protein or glucose that's present. In contrast, other body fluids such as amniotic fluid or plasma can contain glucose and are very high in protein.